Ms. Skinner.
Thank you. I was very impressed with the comments from our San Diego County program, and I wondered if you, I'm going to separately ask our representative from Early Edge to describe how they're, I mean, you gave a lot of just comments, but
Right.
I think those of us who are trying to look at a path for dealing with 0 to 5 are having a difficult time seeing how, if we just go to TK, how we address that other. But what I wanted to hear first from, and you can answer that later, but from our county representative is, how do you see or not see TK fitting into the kinds of thing you described?
I would like to say that the program and what happens for children can happen however the legislature decides to fund it. We will make it happen. We are a group of professionals that have made this happen through beg, borrowing, and stealing when the funding wasn't there. So independent of what we call it, I think the importance is the components. And under the current Race to the Top Early Learning Challenge work, we are learning as a state in different regions, it's a regionalized approach, on rating what works best for family child care providers, infants, toddlers, preschool, and center-based. So there's differentials in how we can rate the quality for that educational experience for children based on their age and their developmental needs. And it's not necessarily dependent on what we call each section of the pie.
This proposal was originally based on the policy that was developed for a ballot initiative, Preschool for All, back in 2006, Prop 82. And it also had a 5-year phase-in, like our proposal. And the way we were going to phase that in was through a quality rating and improvement system. And that was part of the ballot initiative, and that's really where QRIS got its start in this state. First Fives, both state and locally, began to fund and create those systems. And it's all about creating a ladder for higher quality. And that's how we get there. We can create the high standard and say, okay, we have X number of years to get there. How do we get there? QRIS is how we've done that. In California and many other states have done that too. So we think that is why we're confident that we can do this, why we can actually get to the higher levels of quality, is because of the infrastructure that we already have in place. And it's why we were able to get the Race to the Top Early Learning Challenge, is because of the local investments that had already been made, primarily through First Fives.
Mr. Ting.
Just a follow-up question to our chairs. So, I was curious, in particular to Mr. Moore, you're proposing, or the proposal sort of builds out a completely new infrastructure around TK. I had a chance to visit one of our TK programs in my district. It's a great program attached to one of our elementary schools and our preschools. Our preschools through the school district. But I was curious why building out a whole new infrastructure versus leveraging the current existing infrastructure around preschools, because it seems like you're almost creating this this new segmentation that doesn't really exist, or creating a whole new group of providers for 4-year-olds that are having to create new curriculum, new infrastructure, whereas you already have an existing infrastructure that's already serving 4-year-olds, that you would almost be moving that to a different organization.
Right, and I think that's a major misconception of our proposal. I think it's in part because we called it TK. We could have called it pre-K. We could have called it state preschool. The intent here is twofold. The first is embedding pre-K, whether you call it TK or preschool, in our state education funding formula, and there are a lot of benefits for that. You know, one thing that I recognized this past year when we saw significant increases in funding to K-12 was, wow, the per child rate went up significantly for kids that are in TK. But as we saw, nothing happened for our kids in state preschool. So that's a major reason why we took this approach. But at the same time, it's really very important that we do this in a way that does build on our existing structure. So the way it's worked in other states and the way I think it could work in California is school districts get the funding. They contract out with the community-based preschool providers that already exist. Everyone has 5 years to meet the higher qualifications. You get significantly more funding per child than we currently do in state preschool. And the reason why I think we can feel confident that it will happen is because we're going to need a lot more preschools, not less. We don't have lots of facilities lying around. And so we will need to be building on our community-based programs as well. So the intent is not to sort of create another layer. The intent is actually to try and bring two programs together in a way that will work most beneficially for children.
So I guess our challenge is with limited resources we have, the way the program is constructed, it appears to move money from 0 to 3 to 4-year-olds. Is that, it doesn't seem like that is your intention, but can you clarify that? Because that's sort of, those are the choices that we have to unfortunately make with the limited number of resources.
Sure. Actually, it doesn't take any money away from state preschool or general child care or any other program. It expands by $1.4 billion the money currently going to 4-year-olds in what we call this new TK. That then allows a certain amount of money in the state preschool program that currently goes to part day preschool for 4-year-olds to go to either full day wrap for the 4-year-olds in this new TK, because we understand and it is critical that families have full day options, as well as to go to 3-year-olds and infants and toddlers. And it really also, another wonderful part of the proposal is that it also allows Head Start to serve younger children and also to provide more full day. So it's the intent is to provide access for all for 1 year. But by expanding access through state preschool and Head Start to go to 3-year-olds, we'd really be doubling the access for low-income 3s in either state preschool or Head Start, which is what the research tells us works. Is the children who need it the most ought to get the most. And 2 years of a high-quality pre-K program has been shown to be much more effective than just one.
I don't want to cut you off, but we're at 11:20. We have another panel with 5 more speakers coming up. I mean, clearly, you know, this is a great conversation starter, but we don't have the details on the California Strong Start component. To really discuss this in detail. So I want to give you a chance to follow up, but please keep in mind the time. Mr. Ting, Ms. Weber.
I'll just make a quick comment. So it sounds like we have Preschool for All in San Francisco, where the school district runs preschools, and we also have nonprofit preschool providers. So it does sound like that's sort of what you're potentially envisioning for the 4-year-olds as well, where you have the school districts run some, but also the preschool providers are also providing that too. So that's not what I thought going in. So that's very helpful for that clarification.
Great.
I'm not going to take much. Obviously, we need a lot more time to discuss the details because it is very complicated. I was only interested in, not only interested, but mostly interested in looking at your chart here that you had and the significance of those charts. And Perry Preschool and all these other places, and whether or not, just looking at the studies that were done, and what do you attribute the differences to in terms of some programs having long-term effect and some having very short-term effect? The information is so mixed. Some folks have, is it the class size that obviously is significant for one, but many of them have the certificates of BA and see different results. I mean, it would be interesting to know what the differences were. Were the kids coming from different kinds of homes? Was this, I don't know, a Prairie Preschool, whether it's that catered toward middle-class families, or did it,
Sure.
What would be the difference? And you don't have to tell me today, but if you know the difference, it would be interesting to know.
I will say quickly, every single program on this list, except for Oklahoma's pre-K program, is targeted for low-income families.
Okay.
The studies that show either significant results through 5th grade or 3rd grade, that's just because that's as long as they've followed those kids.
Okay.
The ones that have had longer results, of course, they follow them for a longer period of time. With Head Start, where we've seen some fade out by 1st grade, I think what's important there is they took that information and then they raised their standards to where they've seen results. And they raised their teacher qualification standards. Now half the teachers need to have a BA, half the teachers need to have an AA, both with early childhood education and experience. The challenge for Head Start, and we've seen this in the past 5 years happen in California, where all of these teachers, we used to have 12% of Head Start teachers with BAs in 2009, now it's 48%. An amazing achievement and accomplishment. The challenge is going to be the fact that the federal government hasn't provided more funding per child. So salaries haven't necessarily gone up. And now you're going to have a lot of teachers with BAs who may say, geez, if I just get a credential, I could be making a lot more and have a real ability to provide for my family and health care and a pension. I will say all of these studies, the ones that have had long-term results, it's not just the standards that they have, it's the funding, it's the compensation, it's the comparability with the K-12 system in terms of funding.
I know at one point there was a study done with Head Start because kids get a Head Start and then they go into a school that doesn't continue the start. And so it's they're move in, they're there, and then there's not a connect at the kinder and the 1st grade to continue the challenge that's there. For
Right.
those
And
communities.
that's the Head Start impact study that's
Right.
listed here. And what's great is that Head Start has done an incredible job in increasing their quality.
Okay, sounds good. Okay, thank you.
All right, thank you. And so I just want to say, Mr. Moore, that we appreciate. Professor Thompson said that we need to perhaps take this opportunity to talk about improving the new system, even using the term creative destruction. I wouldn't go that far, and so this chart seems to summarize what you're proposing in broad framework. But there's been so much focus on Senator Steinberg's proposal and the TK component of it, but it seems to be just as critical to emphasize the Senator Liu's component for the infant through toddler and the wraparound component for TK, so that it's not just a partial day program, but a full day program that meets the real life needs of working parents. And so I would suggest that you help us focus much more on the bigger picture and not just on Senator Steinberg's TK proposal.
Great. Thank you.
With that, thank you very much, both of you. We wish we had more time to discuss this, but we must move on. So I'd like to invite our last, but not least, our panel for ideas for improvement in child care. We have 5 speakers joining us. Please come forward.
No, I'm going to stand up in a minute so I don't freeze it there. Well, get me some tea then. The mint or whatever. Yeah, it's fine. Yeah, something to warm up.
Najr Deneen. Welcome, everyone. I would like to first ask Danita Stromgren, Public Affairs Officer for the Northern Directors Group.
Thank you, Assembly chairs and committee members. My name is Danita Stromgren, and I represent the Northern Directors Group, which is a coalition of alternative payment child care subsidy voucher programs from Northern California. Thank you for the opportunity to present today. You've heard about the devastating loss in the child care subsidy system and its impact on families over the past 5 years, and now it's time to begin to think of the process for reinvestment. We agree with the staff's recommendation for a holistic approach to early childhood investments, and as I was planning for my presentation today, I tried to think of some creative, innovative, exciting new ways to present what we've been talking about for many years. And really, the reality is that we have been talking about many of the kinds of things that we're going to be presenting from a panel today for many years, and that we need now to look at the existing system, to look at ways to look at a full vision of the systematic reforms that we need to meet all eligible children's needs, 0 to 5, in increasingly high-quality services that allows for parental choice. Federal guidelines do require that there be parental choice in the system, and that includes care during non-traditional hours when so many income-eligible families need that care. We have to increase the services and access to services to ensure that parents can work and increase their ability to earn self-sustaining wages. And we think this can be obtained in 2 ways. We think we need more funding for additional child care in the system. We must incrementally increase those services each year because there are thousands of children who need additional services and are on waiting lists. Most importantly, we need to increase the reimbursements and funding for child care subsidies, and you've heard numerous speakers today talk about that. There's the regional market rate, which caps child care providers at the market rates that are effective back in 2005. And there's the standard reimbursement rate that hasn't been increased since 2007. With the regional market rate, we're in essence limiting access to care for families to about 50% of the providers in the community. And again, you've heard this already today. And you've heard about the importance of high-quality care from Dr. Thompson and others. We're limiting access for those families to potentially the lower-cost care and potentially the lower-quality care, and these are the children who need the highest quality environments most importantly. So we recommend a reform to the reimbursement system. You've heard about the challenges between the standard reimbursement rate versus the regional market rate. We think we need to put this into a single system that would combine both the standard reimbursement rate as well as the regional market rate that's based on the current market rate in the local communities with some kind of a tiered reimbursement that reflects the services that are provided. We wouldn't go into a restaurant and pay for hamburger and expect to get filet mignon. And we're not going to get the highest quality of services if we're paying at the lowest rates. So through the budget process, we recommend incorporating incremental increases in the funding for reimbursement rates also over the 3 to 5 years. If you picture it, we have one system with the standard reimbursement rate for contracted centers and the regional market rate for the voucher programs, and then you reimburse those programs accordingly within that system. And this needs to happen for the regional market rate, it needs to happen at the 85th percentile so that families can access at least 85 out of every 100 providers that are available. This increase will also ensure viability for the contracted center-based programs that have come under a lot of difficulty in terms of operating. In another area of quality, we also feel the need to reinvest in some of our quality improvement dollars into the nutrition programs that are operated through child care programs. These programs have demonstrated great success, and recent research by the Federal Center for Disease and Control Prevention has shown that the level of obesity in children under 5 years of age has actually gone down, which is great news. However, part of this has been attributed to the increased requirements of nutrition and increased activity levels in child care programs. But over 8% of children under 5 remain obese. And so we need to build on these improved results and provide increased funding for those child care programs that operate under the USDA Child Adult Food Nutrition programs. Both those child care and school district programs have received increased food and nutrition standards, but only school programs have increased the funding. So these are just 2 areas, and my colleagues will be talking about other areas for improvement. I think we, in the field, overall agree to a large number of similar areas for improvement, and so we've divided up and sort of are focusing each of our comments on specific areas. So we look forward to working with you as the budget moves forward, and thank you again for your time.
Next, we have Deneen Micheletti, Chief Executive Officer of the California Alternative Payment Program Association.
Hi, thank you very much for having us here today, and I'd like to really thank the staff who did such a great job on the agenda, but more so leading up to this committee hearing. They took the time to really talk with the field, go out and visit programs, and really need to be recognized for doing their homework in preparation for this hearing. I'm Deneen Micheletti, representing the California Alternative Payment Program Association. Our membership is a network of mixed delivery, public and private agencies that support working families and connecting them with child care so that they can move through the system and maintain self-sufficiency for themselves, and where they can to support the long-term academic outcomes for their children. Before you, and you have a handout, are 6 recommendations that we've looked at in response to the ask from the committee to identify areas for improvement. A preface to all of the remarks is that moving forward, whether it be TK or strengthening our existing system, is that you have to value what we have in place. We have a rich 35-plus year mixed delivery system of public and private entities that come together. And it is important to recognize that there is a vast capacity of this existing system to grow, to take on more, and that this existing system supports not only the educational needs and connecting the children to great environments, but also of parents. And so I need to underscore, and I appreciate comments from Assemblymember Skinner, who really has vested her time in looking at APs and how we work. But we are all about parents working and earning and the children learning. And it's a both and, it's not an either or. So the first recommendation we have before we can go to TK, which I want to underscore, CAPA supports unequivocally more money coming into the system for kids. We are just grossly underfunded across the board. Having said that, since 2007-8, we've actually thrown out 110,000 kids. And I want to underscore that because you have to give a face to the slots that have been eliminated. These aren't families. These are families who are eligible, who had a slot for their infant or toddler, and overnight we threw these families out. And so I think to have a starting point, it's restore those 110,000 slots, get those families reconnected, those families who are living in dire poverty. And as I think Assemblymember Nastandi was asking, what's the poverty rate in California? So I was Googling as we were listening. And the Stanford report from October 2013, again reinforced what I think has been cited before. 1 in 4 live in poverty. When you remove child care or safety net, you add an additional 12% to that 25%. Excuse me. Next, the recommendation, and again that I have touched on, is before you do anything, for our poorest of poor families and our CalWORKs working families, you've got to connect our existing delivery infrastructure in a real way to whatever we want to do. If we want to connect our poor families, then they need to be supportive, because I can guarantee you that a family that we are supporting with child care are not in a place to receive information on the quality setting of a TK minus the issues of hunger, minus the issues that they're facing of homelessness. You can't sort of silo one specific information in the lives of the families we serve. It's important to call out who exists in these partnerships. Again, it's alternative payment programs, resource and referral agencies, our very high quality Title V centers who are closing their doors and have shuttered thousands of centers since 2007. Family child care home education networks, family child care, and small business early care and education providers. Finally, in talking about the existing infrastructure, I'm going to underscore a bit. The Ledge Analyst's Office spoke on it, and Michelle Rutherford did an eloquent job on talking about the devastation that has happened to, again, the public and private existing system that supports early care and education. We don't know how to open doors moving forward in many of our programs. Just in a nutshell, our programs in the infinite wisdom of the legislature when they were created was based on a system of monies that went out the door. So that's how we're paid. So you're paid on a percentage. Since 2010, 54,000 kids were eliminated from stage 3 child care overnight. That's monies that didn't go out the door. But that resulted in 114 separate changes that agencies had to make to disenroll families to inform parents that their services were terminated. Nothing came with payment. Overnight, and I'll say it's a punitive action that Governor Schwarzenegger took in eliminating stage 3. Overnight, he reduced from 19% to 17.5% the ability of agencies to notify and to support families. That overnight he put them into crisis. Overnight, one day they had child care, in 30 days they didn't. And our caseloads for our caseworkers went from 1 to 40 to 50 to 1 to 200 plus 250 now. And so I underscore, you have to address that. Recommendation 3, stabilize again what we have before you build new structures. CalWORKs Stage 3 child care. Thankfully, last year, there was recognition by the legislature to fund Stage 3 based on what the caseload was. It's been a long time in coming. And finally, we think everyone has it. By the time the families transition from CalWORKs Stage 1, 2, and 3, your CalWORKs Stage 3 families are your success stories. They're the ones we've invested in a couple years. They're the ones that are going to launch to self-sufficiency. We want to support them, so fund Stage 3 from the get-go at an appropriate and stable number. Our families deserve that. Again, I just want to underscore that the value of the existing public and private delivery system, and that's CalWORKs and our general education programs, overall in the last 5 years have taken really draconian cuts. And where many of the areas have been restored, overall, our early care programs still have a net loss of over 30%. 30%. That's your starting point moving forward. At the height of the recession, when we were grappling with needs and people looking for work, we were cutting child care options for them. Finally, recommendation number 5. Value local agency control and use of technology to best meet the needs of families and to protect the public dollars. Our child care system is complex. And again, these systems that have been in place, these local partnerships for 35 plus years, rely on them to provide input on how to best serve these families. There's excessive paperwork and documentation, and there hasn't been a thorough overview of the real detailed eligibility and need and redundancy of paperwork and lack of use and recognition that technology, we actually can store things on a disk nowadays. We have made incremental inroads into that, and I just want to bring recognition, AB 1944 from Garcia, to eliminate a burdensome paperwork that does nothing to support the program and bring integrity, and AB 2101 that brings us into the new century where we can actually store things paperlessly and on a disk and free up hundreds of thousands of warehousing dollars of paper. Recommendation 5, we've got to restore a centralized eligibility list. This is critical. This centralized eligibility list was created, and it was that after it was enacted, not enough thought and resources were given to development of the centralized eligibility list, and it collapsed. Whether you liked it or not, that resource provided somewhat of a snapshot of what the waiting list and the need is in every single county in California. When it was eliminated, there were nearly 200,000 families on it. And now it's gone. And so when the legislature and Department of Finance and all of us come together and we want to support you with supporting families and addressing the needs and the poverty issues out there, we can't give you a fair idea of what the need is because we don't have an eligibility list. I would look at that strongly to help support you in your decision making moving forward. And finally, recommendation is again, I think that Assemblymember Weber opened that really our budget is a value of statements and certainly how we view our children and our older people. I would say in regards to early care and education, make a value statement and a value action and move all of the programs that support early care and education back under the Department of Education, back under the Proposition of 98, and give some guarantees that we know that right now child care is growing, the need is growing, and early care and education should also be supported with growth in COLA moving forward. In regard specifically to the TK, I'm just going to note a couple bullets. First off, in the TK discussion, if the time ever comes, rebench the discussion and ask some of us who work in the field every day, what do you think ought to be involved in a TK? We weren't involved in the discussion at all. We're late to the game. Connect our existing delivery infrastructure to what we know will connect our poorest of poor families to these very rich educational offerings. Value the needs of working families. Start with a full part-time preschool doesn't work. It's full day, it's wraparound, that's your starting point. I'm going to leave with that. But again, I just want to say that our existing mixed delivery system is integral to connecting our poorest of poor families, and that without the inclusion, our most fragile of families are going to be left behind in any of these advances that we make. Thank you.